my name is Chris.
And my name is Tammy.
Today we're going to talk to you a little bit about in vitro fertilization and other aspects of technological reproduction.
But first, Chris, why don't you tell us a little bit about the history of in vitro fertilization?
Sounds good to me. Beginning all the way back in the 18th century, infertile women were being assisted in getting pregnant with medical technologies. In the late 1700s, an English doctor, John Hunger, and French physician, Michael Augustin, were credited with the first artificial insemination. The procedure was frowned upon by others in the field, although the procedure picked back up in popularity in the mid-1800s. It was not until July 25, 1978, in Oldham, England, Louise Joy Brown was born. She was the first of what are now millions of what they call test tube babies, conceived via in vitro fertilization. So now that you have a little bit of history on in vitro fertilization, Tammy, why don't you tell us a little bit more of the scientific aspect?
Sure. There are 5 steps to the in vitro fertilization. The first step is ovarian stimulation. This step involves the process of using fertility drugs. These hormones take over a period of 8 to 14 days, which stimulate a woman's ovaries to produce several eggs per menstrual cycle instead of just one. Successful in vitro fertilization usually requires the fertilization of multiple eggs. Some may not fertilize or develop normal after fertilization. During this process, the physician will use ultrasounds or blood testing to determine when the eggs are ready for retrieval. The second step in vitro fertilization is egg retrieval. Once the eggs are deemed ready for retrieval, the doctor performs a transvaginal ultrasound aspiration. This is a simple surgical procedure that uses a small amount of anesthesia. Once the ultrasound locates the mature follicles in the ovary, the doctor inserts a needle into the follicle and removes the egg with suction. If this ultrasound can't find or access the ovaries, doctors might have to perform laparoscopic surgery. This technique, in which doctors cut a small incision in the abdomen and locate the ovaries with a tiny fiber optic lens, is simple and short but requires stronger anesthesia. The third step in vitro fertilization is insemination. Once the eggs are retrieved from the ovaries, the doctor will then examine them to see which ones have the most potential for pregnancy. They place these eggs in an in vitro fertilization culture medium to await insemination. Meanwhile, they separate the father's sperm from his semen. The most motile sperm are then inserted into the egg in the incubator. The fourth step in vitro fertilization is fertilization in embryo culture. Usually, within a matter of hours, a sperm cell penetrates an egg and fertilizes it. The following day, doctors visually confirm fertilization if they can see 2 pronuclei. These pronuclei are the basis of the embryo formation. They will unite to form the nucleus of the zygote, which divides to become an embryo. A 2 to 4 cell embryo appears approximately 2 days after fertilization. On the 3rd day, a 6 to 10 cell embryo is seen. 5 days after fertilization, the embryo can be called a blastocyte, which means it has formed a fluid cavity that results in the formation of fetal tissues and placenta. However, many embryos are not observed for this long. They can be placed in the uterus as early as a day and as late as 6 days after fertilization. In most cases, they're observed for 2 to 3 days to determine if the development is normal. Step 5 of in vitro fertilization is embryo transfer. About 2 to 3 days after fertilization, the resulting embryo or embryos are transferred to the woman's uterus. Doctors suspend them in a drop of fluid and draw it into a transfer catheter, a long, thin, flexible tube that has a syringe on one end. Then they guide the catheter into the vagina, past the cervix, and into the uterus. If the embryo or embryos do attach to the uterine wall, a positive pregnancy test will result. Now that, in short, was the process of in vitro fertilization. And now we would like to discuss the moral issues of in vitro fertilization. Chris, would you like to further discuss the controversy of in vitro fertilization?
Absolutely. So let's discuss some of the aspects of in vitro fertilization and how it takes away the dignity of the human person. Number one, the unity between a man and a woman is broken. Number two, their right to procreation and the obligation to do so. And three, the act of masturbation, which is required in a lot of cases in order to perform an in vitro fertilization. So therefore, in vitro fertilization breaks the unity between a man and woman by procreating outside of the body. And as I said, masturbation is often required for in vitro fertilization. So let's see what the Catechism of the Catholic Church speaks about masturbation. By masturbation is to be understood the deliberate stimulation of the genital organs in order